Details about standalone questions. What are the areas of focus of these questions? Well, clinical sciences, neuroimaging, genetics, biological correlates, development over the lifespan. Clinical presentations is the second one that was highlighted, we went through. Establishing diagnosis based on presentation, differential diagnosis, demographic group differences, common comorbidities, risk protective prognostic factors, and just features, recognizing if it's disorder A rather than disorder B, C, D, or E. Also assessment, like how do you work a patient up? And then it's going to be treatment and management. As we mentioned, treatment is the highest, biggest component of questions that are testing you on any particular disorder. Now, what about the focus of diagnostic questions? Well, really, the diagnostic focus is, it's never focused directly on diagnostic criteria. It's not like, which of the following is a criterion of somatic symptom disorder? Rather, you're presented with a clinical vignette and asked to choose what's the most likely diagnosis based on that vignette. As you've seen me do many, many times over the course of my lectures. So kind of keep this in mind. That doesn't mean that the information about a diagnosis in the clinical vignette is completely adequate. It may not be adequate. There might be like a description of depression with only like 4 symptom criteria. And, and then you're like, well, that doesn't meet major depressive episode. Maybe it's that other depressive disorder, but that's not given me as an option. But, just sort of like, what's the most likely one? Again, they don't always give you, and this is where a lot of people freeze up. It's like, well, I don't know what to do. I can't fully establish that this is major depressive disorder because it's like full criteria for a major depressive episode. That's okay. Choose the most likely one. Don't freeze up. Again, you have to get kind of comfortable with the uncertainty. You're going to feel a lot of uncertainty on the exam when you're answering questions. I guarantee it. Study method, don't just review and memorize disorder criteria. Learn how one disorder differs from another. You've seen me do this over and over. How is anorexia different from bulimia, different from binge eating? How somatic symptom disorder different from illness anxiety disorder? Things like that. Disorder A, learn that. Disorder B, learn that. And then learn that how they're the same and different. Because you're going to be asked to identify what's the most likely diagnosis, and the vignette will lead you one way or another. So here's an example, again, neurocognitive disorder with Lewy bodies. Again, this is just the core and suggestive diagnostic criteria. And this is the way you're going to be tested on it. You're not going to be tested like, which one of these is a criterion of, NCD with Lewy bodies. You're going to be tested like this. You're going to see a vignette and then asked which one is the most likely diagnosis, right? Neurocognitive disorder with Lewy bodies. This is how you get tested. Now, there are some fact-based questions, as I mentioned. What's the most common cause of preventable intellectual disability in industrialized countries? It's going to be fetal alcohol syndrome, because the key word there is preventable. Pay attention to the question. Don't assume. Again, you're going to get tired. You're going to be reading questions without really understanding them. Take a deep breath, reread the question again. Make sure you're answering the right question. You see, I can change this one question, change the word preventable to inherited, and the answer completely changes. The most common cause in industrialized countries is trisomy 21 or Down syndrome. The most common inherited cause is Fragile X syndrome. So yes, trisomy 21 is a chromosome or genetic disorder, but it's usually not heritable. It's it's heritable in like, less than 10% of the cases. It's due to meiotic non-disjunction, like poor formation of the ovum or the sperm, usually. Exam taking tips: if you're unsure, read that question again. Identify the key point. What am I actually being asked here? Sometimes you've seen me also do this. It's like, hold on a second, like, I'm confused. Okay, so 4 of these are wrong and 1 is right. So which one out of these, like 5, kind of is different than the others? Sometimes you have to talk your way through the question and as you're evaluating the response options. Eliminate clearly wrong response options. Answer every question. There's no downside to guessing. Some you'll get right. You got a 20% chance of getting it right if there are 5 response options. If you could eliminate 2 as being clearly wrong and you're choosing from 3, now your chance of getting the right one is 33%. And again, for the standalone sections, you can flag for review. If you are into that, I would answer the question even if incorrectly, or just take your best guess, and then you could flag for review and then return to it anyway. And then don't fret over every question. You can for sure get 1 in 4 questions wrong. So that means, out of the 425 questions, you can get over 100 questions wrong and pass the exam. And you will get questions wrong, probably quite a few of them. Details about the linked item set exam, vignette exam questions. So these are presented as these longer vignettes, so I'll just quickly read this. An inpatient medical service requests a psychiatric consult for ongoing management of a 78-year-old female who's currently being treated for dehydration. The day of admission, the patient was found by a grocery store manager to be extremely nervous and reportedly seemed lost. She appeared tearful and tremulous when the manager and assistant tried to assist her. She repeatedly screamed, "Quit looking at me." She was unable to verbalize what had created her concerns or where she lived. An ambulance was called and she was subsequently transferred to the ER for further eval. Her personal belongings reveal an empty pill bottle in her purse with a 3-year-old prescription for alprazolam. The name on the prescription is apparently that of her husband's. Her personal information reveals her address to be a few blocks away. When her home telephone number is called, there is no answer. Social services learns that her husband passed away nearly 2 years earlier. They had no children. There's no next of kin. According to the medical team, her limited workup has so far revealed moderate dehydration and moderate cortical atrophy as visualized on the head CT without contrast. First question, given the information provided so far, which diagnoses are most consistent with the clinical presentation? And I'm to choose 2 out of neurocognitive disorder, depression, delirium, anxiety, and bereavement. And it's going to be NCD and or dementia and delirium. Next one. I'm to choose 1. Given the likely diagnoses you chose in the previous question, what would be your next clinical step? Start an antidepressant, restart her alprazolam at a low dose, call the Department of Health and Human Services, complete a thorough medical workup. Given the suspicion of delirium and the information provided in this vignette, what are the most probable contributors to this condition? Choose 3 out of 5. Neurodegenerative disease, depression, dehydration, alprazolam use or withdrawal, or Wernicke's encephalopathy. There are going to be A, C, and D. Neurodegenerative disease like Alzheimer's disease, dehydration, and alprazolam use or withdrawal. Now, again, this one may be easy for you, or you might be kind of like, I don't know how to answer this. It could be any of them. Yeah, but again, let me give you an example. Every single vignette you see, the person could be malingering or have factitious disorder. So, I can always say, well, I can't answer this question because it could be malingering or factitious disorder. Yeah, but if there's no evidence at all in the vignette suggesting something, then don't go with it. There's nothing suggesting Wernicke's encephalopathy. There is evidence at least suggesting the right answers here. Dehydration, there's something alprazolam, neurodegenerative disease. Clearly, she seems like she's likely to have some of that. She could have delirium on top of dementia. right? Given your likely diagnoses in the patient's presentation, which medical legal steps will you likely take? Choose 2. Assess whether the patient has the capacity to provide informed consent for further non-emergent treatment. Seek a guardian if she does not have capacity to provide informed consent. To maintain her confidentiality, do not share your working diagnosis with the medical team. Advise the patient to assign power of attorney for healthcare to you so you can complete your assessment. So what are the 2 most likely ones? Maybe they're not perfect, but the top 2 are, the bottom 2 are just kind of ridiculous. All right, and then on this, to complete this presentation, also on these linked set vignette questions, this is how they look. So you could look this up yourself. You can actually, just really kind of delve more into this. But again, it kind of like it explains things too, tells you what you got to do. Watch the video, whatever. It's like I'll clearly explain. Take a deep breath and read the instructions. It's okay, you have time. And once you learn them, then you'll be fine. And then there are going to be questions here. It shows you all of the features. You can play, pause, stop, rewind, drag the volume slider to adjust the volume. All of these kind of features here, right? Show exhibits, so sometimes there might be like, I don't know, an EKG. I doubt it, but maybe some neuroimaging would be the most likely one. So there could be other kind of things, assets or exhibits that are attached. And here you go. Here's actually an MRI scan. That's exhibit 2 here. All right, thank you very much. I hope that helps. If you ever have questions or concerns about the exam, need some advice, go ahead and email me at drjack@americanphysician.com, drjack.